Other function is absorption. Peritoneal cavity absorbs a lot of things. So this function is used for the dialysis as well. And another function is supporting the viscera. Now, how the viscera are exactly related to the peritoneum? According to the relation, we can divide the organs into three types. Now, this is a horizontal section of the abdomen where we can see the peritoneal cavity, which is represented as the black area, and the layers are the parietal peritoneum that is covering the anterior abdominal wall, right, and the visceral peritoneum also can be seen, which is covering the organs. So this is parietal peritoneum, which is covering the posterior abdominal wall. This is the visceral peritoneum covering the organ. Now I said that the organs are invaginating into the peritoneum from behind, from posteriorly. When it does so, we can see that some of the organs will go very deep into the peritoneum like this. So as it is covered by the peritoneum almost on all the area like this. Whereas there are some organs which try to push into the peritoneum, but it does not go as this. So what happens is that some of the part of this organ will be covered by peritoneum, but some area is not covered by peritoneum. This area, look at this. This organs, it is pushed into the peritoneum, where we can see that this is almost, it is covered by the peritoneum, but again this area is not covered by peritoneum. Now there are other group of organs where these are present on the posterior abdominal wall. They don't go in deeper into the peritoneum as like this and this. So as their anterior aspect is just covered by the peritoneum, but majority of the other area of these organs are not covered by peritoneum. Now you can see that here this organ, it is pushed into the peritoneum, and here this area, we can see that this area is not having peritoneum, but the layer of the peritoneum that pass or that moves onto the posterior abdominal wall, you can see that the peritoneum is covering the organ and it is passed or it is attached to the posterior abdominal wall. Through the structures, the vessels, nerves, lymphatics can enter into the organs, because all the vessels, nerves, lymphatics, all are present on the posterior abdominal wall and the lateral abdominal wall. So they pass easily into the organ between the two layers of peritoneum. Again we can see here through this area the vessels can pass and supply this organ. Vessels or nerves, here also this will be supplied. So this area, which is called as a root of the peritoneum, where the structure is attached to the posterior abdominal wall by the part of peritoneum. Here you can see the visceral peritoneum is covering the organ and it is reflected onto the posterior abdominal wall. So there is a gap between the two layers of peritoneum here, through which the structures can enter and leave an organ. Anyway, let's divide this area into, or divide this organs into three: intraperitoneal viscera, interperitoneal viscera, retroperitoneal viscera. So what is the difference? Intraperitoneal viscera completely surrounded by peritoneum. This structure is intraperitoneal viscera, almost completely surrounded by peritoneum. Examples are stomach, superior part of duodenum, jejunum, ileum, cecum, appendix, transverse and sigmoid colons, spleen. Now the next group is interperitoneal viscera. Here most of the part of the viscera surrounded by peritoneum. This structure, most of the part surrounded by peritoneum. Examples are liver, gallbladder, ascending, descending colon, upper part of rectum, urinary bladder, uterus. The third group is retroperitoneal viscera. As the name suggests, retro means behind. So these organs are present behind the peritoneum. Some organs lie on the posterior abdominal wall and are covered by peritoneum on their anterior surface only. Example is kidney. So this structure is kidney. Other structures are suprarenal gland, pancreas, descending and horizontal parts of duodenum, middle and lower parts of rectum and ureter. So these are intraperitoneal viscera, interperitoneal viscera and the retroperitoneal viscera. Now there are structures which are formed by the peritoneum. We have seen that the peritoneum is the one which is covering the abdominal and the pelvic organs. But there are some structures which are formed by the peritoneum. It's very easy. Let's understand this diagram. Again, a sagittal section, and here the posterior aspect can be seen, where the parietal peritoneum is covering the posterior aspect of the anterior abdominal wall, and it is reflected onto the diaphragm. Then from there it is reflected onto the liver. So this orange color represents the parietal and the blue color represents the visceral peritoneum. So the first structure that is formed by the peritoneum is omentum. Omentum are two-layered fold of peritoneum that extends from stomach to adjacent organs. So let's consider that this is the stomach. Now let's start from here. The parietal peritoneum covering the inferior surface of the diaphragm, reflected onto the liver. Now from the liver it reaches the inferior surface. From there it is reflected onto the stomach. So this layer, the first layer, is reflected onto the stomach, and that covers the stomach anteriorly, and that is going downwards, right? And that is again reflecting back and is reaching the transverse colon. It is covering the transverse colon posteriorly, posterior inferior aspect of transverse colon. Then it goes to the posterior abdominal wall. Now anyway, I said like this, but it is, let's consider in another way, that we can say that we are going to consider the peritoneum from different aspects now. So please listen to me carefully. If you look at this stomach and these attachments, what you can see here, this one and this one, these are called as the omentum. This is one omentum and this is another omentum. So these are actually extensions of peritoneum from the stomach. So it is one aspect, you can see it is attached to the liver. So this is one omentum, and another aspect you can see it is attached to the lower aspect of the stomach, and this is also omentum. And definitely you can see the peritoneal cavity. I will describe omentum in little detail very soon. So if you look at this diagram, what you can see here is the stomach. So stomach, I'm just going to compare these two diagrams now. This layer, what we can see here is the part of the omentum that is extending from the liver to the stomach. So this is the liver is being reflected and showing the inferior aspect. So the peritoneum that is covering the inferior aspect of the liver, that is reflected onto the stomach here as this omentum. So this is representing this omentum. This omentum is called lesser omentum. This is a lesser omentum. Now we're just compare here, the lesser omentum is covering the anterior surface of the stomach, then it is reflected down to the stomach, and that hangs down like an apron, and that goes again and covers the transverse colon, as you can see here. Definitely the lesser omentum has got two layers. Greater omentum, this is greater omentum. Greater omentum also has two layers. We will discuss about that very soon. So the lesser omentum can be seen here, and what you can see here is the greater omentum, which hangs down like an apron. As you can see here, this is hanging down, and it is almost reaching almost occupying the peritoneal cavity, and that reflected backwards. You cannot see that reflection backwards, but it is going and reflected backwards, and then it is getting attached to the transverse colon. So that we can see here, transverse colon. So I hope you got some idea regarding this. Don't worry, we will explain this in more detail. So the take home message from this slide is we have two omentum, lesser omentum and the greater omentum. and it's represented here as lesser and greater omentum. Peritoneum is a complicated topic, but we'll make it simple. So lesser omentum is this one. It is a two-layered fold of peritoneum which extends from the porta hepatis to the lesser curvature of the stomach and superior part of duodenum. Now you should know some terminologies here. Porta hepatis. Porta hepatis is the area of the liver where the structures enters and leaves the liver. So porta hepatis is the limitation for the peritoneum to extend backwards. Let me tell you that another way. This area which represents the porta hepatis. The porta hepatis. So there are some structures which are entering and leaving the liver through this area. So the peritoneum, what it does, it covers the surfaces of the liver. I'm talking about the visceral peritoneum that reaches the inferior surface. It is trying to go back onto the inferior surface still backwards, but it is not possible because some structures are covering or some structures are passing into the liver through this area. So the peritoneum is not able to go further backwards. So what it does, it is going to get reflected downwards onto the stomach. So that is what is happening here. As you can see here, now the peritoneum is not seen very clearly in this, but just make a peritoneum. So we are going to create a peritoneum. It is covering the surfaces of the liver. It goes onto the inferior surface of the liver. It is trying to go backwards, but because of this structure here, it's not able to go backwards. So it is reflected downwards onto the stomach. So that's what you can see here. It is reflected onto the stomach. Right here you can see again the peritoneum tries to go backwards, not possible. So it is reflected onto the stomach. Now there are other terms, so I hope you got it. Porta hepatis. Now lesser curvature. So the stomach has got two curvatures, lesser curvature and the greater curvature. So what you can see here is the lesser curvature, which is very near to the liver, and this is the duodenum. The stomach continues the intestine, the small intestine. The first part of small intestine is called duodenum. So what happens is that lesser omentum is a peritoneal fold that is attached to the liver and to the stomach and to part of duodenum. So specifically speaking, the attachments are above to the liver near the porta hepatis, below to the lesser omentum, and to the superior part of duodenum. Duodenum has got four parts: first part, second part, third part, and fourth part. The first part is also called as superior part. Now we can just divide the lesser omentum into two, which can be called as hepatogastric ligament, hepatoduodenal ligament. Hepato means liver, gastro means stomach. Again here hepato means liver, duodenum means, of course, it is duodenum, the first part of duodenum. So the lesser omentum, which is extending from the liver to the stomach, is called hepatogastric. So extending from the porta hepatis to the lesser curvature of the stomach. Whereas hepatoduodenal ligament is the one which is attached above to the porta hepatis, below to the duodenum. So this is what we were talking about, lesser omentum, and the next one is going to be the greater omentum, right? Let's see. Greater omentum. You need to be very careful in this area. Please listen to me properly. Greater omentum. So I said greater omentum is like a fold of peritoneum that hangs down and goes back, returns back. So in this picture, it's very clear that this is the stomach and this is a transverse colon. It's a part of the large intestine. Look at this diagram. Again, the stomach, transverse colon can be seen. The greater omentum hangs down and moves backwards, attaching to the transverse colon. So how many layers it has? Anyway, let's see that detail. So it has got four layered fold of peritoneum. The anterior two layers descend from the greater curvature of the stomach and the superior part of duodenum and hangs down like an apron in front of coils of small intestine and then returns upwards and attaches to the transverse column. Yeah, this sentence is little complicated, but let's simplify it. Now, to understand better, we need to go little backwards up to the lesser omentum. Let's see the lesser omentum once again. Lesser omentum is the one which is connecting the stomach to the liver, or it is a part of peritoneum that is connected to the liver and the stomach. But if you look at lesser omentum has got two layers. This layer, which if you trace this layer, let's trace back from here. The parietal peritoneum covering the anterior abdominal wall, inferior aspect of the diaphragm, reaching the liver, superior surface, anterior surface, then inferior surface, then from there porta hepatis. So let's imagine the porta hepatis here. From the anterior aspect of the porta hepatis, you can see this peritoneum that moves onto the stomach. Now, there is another layer. Look at this behind, this one. This is the layer of the peritoneum. For that, we need to trace from this area. There is a peritoneum, parietal peritoneum, that is covering the posterior abdominal wall, that moves upwards. Try to reach the posterior aspect of the liver, and it is trying to move further upwards, but not possible because of the attachment of diaphragm, because diaphragm and the liver are closely attached. If you look at the superior aspect of the diaphragm, we can see that the area between the diaphragm and the liver are very minimal, and at some point we can see that the liver is very closely attached to the liver, so there is no space for the peritoneum to move upwards and reach and to cover the whole of the liver. Suppose if the liver is little placed downwards than the diaphragm, the peritoneum can easily go and cover the liver fully, but here it is not possible because the diaphragm, there is no space, or the diaphragm is closely attached, very much attached to the liver, so there is no space between the diaphragm and the liver, so the peritoneum is not able to pass through that. So what happens is that the peritoneum passes onto the inferior surface of the diaphragm, then it is reflected downwards, because again porta hepatis is there here, so it cannot go further anteriorly, so it reaches the porta hepatis. So there are some structures in the porta hepatis, vessels and nerves, then it is going to cover these porta hepatis posteriorly, and it is going to get reflected onto the stomach. Now where the stomach? Now let's see here, there are two layers, anterior layer, posterior layer of the lesser omentum. Now the lesser omentum is going to cover the stomach. Now stomach has got two surfaces, anterior surface, posterior surface. Now the first layer is going to cover the anterior surface, second layer is going to cover the posterior surface of the stomach, then it reaches the greater omentum. So what we can see here is, this is the stomach, greater curvature, so the lesser omentum covering, this is the anterior layer of the first layer of the lesser omentum that covers the anterior surface of the stomach, reaches the greater omentum. Now you should know one more thing, is that here at this point another layer also present, right? That is the second layer, that is forming the posterior layer of lesser omentum, posterior, covering the posterior surface of the stomach, reaches the greater omentum. Now there are two layers now, first layer, second layer. These two layers move downwards, then this layer, this part is called as a greater omentum. What you can see here is greater omentum, but as you can see here, greater omentum is reflected backwards. Now what is going to happen here? Look at this here, first layer, second layer. Now the first layer becomes the fourth layer, second layer become the third layer. Now let's see what happened. I said that greater omentum is having four layers. Now this part is a greater omentum, Now look at the layers. How many are there? 1, 2, 3 and 4. There are 4 layers. I repeat, 1, 2, 3 and 4 layer from anterior to posterior. So what is happening here actually? The first layer, that is going to become the 4th layer. The second layer is going to become the 3rd layer. This is because the first and second layer returns back. So I hope this is clear. So we have totally 1, 2, 3, 4 layer. Now let's consider these 2 layers, the 3rd layer and the 4th layer. Now the 3rd layer passes upwards, going to cover the transverse colon, again the superior aspect of the transverse colon, anterior surface and superior surface. Then it is reflected onto the posterior abdominal wall, onto the pancreas, this structure is pancreas. Now from the pancreas it is going to, pancreas is a structure which is very much closely attached to the posterior abdominal wall. Now from there this becomes the parietal peritoneum, and that goes and attaches or pass onto the inferior surface of the diaphragm. Then from there it is reflected onto the liver and going to form the second layer of lesser omentum. Now let's see what happens to the 4th layer. So here the first layer becomes the 4th layer, second layer becomes the 3rd layer. So we have seen the 3rd layer. Now let's see the 4th layer. The 4th layer passes upwards, then it is covering the inferior aspect of the transverse colon. Then it is reflected again back to the posterior abdominal wall, reaches the pancreas. Then it passes downwards. Then this forms the parietal peritoneum, but again reflected onto the intestines. You can see here it is reflected onto the intestines. Then it's covering the intestines. Remember, there is not a single intestine here. It is showing as a single section, but actually we can see there are a lot of sections of intestine, because intestines are 6 meter long and it is coiled. So you can see a lot of sections of small intestine, but here it is represented as a single one. Anyway, now from here it is covering the intestine, then it is reflected back again onto the abdomen and again forming the parietal peritoneum that moves into the pelvis. Then in the pelvis it is going to cover the rectum, anterior aspect of the rectum, the uterus, urinary bladder. Then this all are the parietal peritoneum, what you can see here is. Then it is reflected onto the anterior abdominal wall, posterior aspect of the anterior abdominal wall, reaches the diaphragm, again reaching the liver as the visceral peritoneum, reaching the inferior surface, reaching the porta hepatis. Now from here this is reflected as a first layer of lesser omentum. Now let's see this diagram. This is the first layer becomes the 4th layer, what we can see here. First layer becomes the 4th layer, and the 3rd layer, which you can see here, this is 3rd layer, and this the 3rd layer, the second layer becomes the 3rd layer, and it is reflected onto the transverse colon. Now let's name these structures: lesser omentum, greater omentum. This structure is called transverse mesocolon. This structure is called mesentery. Okay. So in an infection, if an infection occurs in the intestine, plasma cells formed in the lymph nodes combat the infection and help prevent it from spreading the peritoneum. The greater omentum is also called as a policeman of the abdomen. So you can see that it is hanging like an apron, and it is going to cover almost all the intestines. There are intestines, small intestines, which are seen posterior to the greater omentum. So it is going to cover, or it is lying anterior to the small intestine. Any infection in the peritoneal cavity, the greater omentum can move and it can reach that area and it can seal off that area, so that the infection will not spread into the general peritoneal cavity. So this is called as a protective function of the greater omentum. So another diagram, the same diagram is magnified, as you can see here, how the layers are of the peritoneum. We can also see the pancreas very clearly, and this is a transverse colon. You see the first layer of greater omentum becomes the fourth layer, the second layer becomes the third layer, you can see very clearly, and it is reflected onto the transverse colon from there, and this it is reflected onto the posterior abdominal wall. So transverse mesocolon has got two layers, upper layer and lower layer. Upper layer is nothing but it is the third layer of greater omentum, whereas the lower layer is the fourth layer of greater omentum. Lesser omentum, where we can see clearly that this area is the porta hepatis. Greater omentum. Now what are omental bursa? What is omental bursa? Omental bursa is a sac-like area which is present behind the lesser omentum and the stomach. So this area, what we are talking about, is the lesser sac or the omental bursa. Now this is a space that is behind the stomach, lesser omentum, this area. So this is the area again behind the stomach. This area is the lesser sac. Lesser sac gives some room for the stomach to expand. What are the walls of lesser sac? Lesser sac. The terms should be careful. This is lesser omentum. This is lesser sac. Now what we can see here is this part is called the greater omentum here, and this part is called greater sac. So both are actually, the greater sac and the lesser sac, both are peritoneal cavities, but the location is different. That's it. This is large. This is the greater sac, whereas this area is present behind the stomach and lesser omentum, and it is very small. So this is called as lesser sac. So remember the terms: lesser sac, greater omentum, lesser omentum. Fine. Now let's see the walls of lesser sac. Lesser sac is also called omental bursa. Superiorly, the peritoneum, which covers the caudate lobe of the liver and the diaphragm. Yes, we have seen that the peritoneum, that is covering the inferior surface of the liver, inferior surface has got a lobe, and that's called caudate lobe. So it is covering the caudate lobe, then it is reflected onto the stomach as the second layer of lesser omentum. So this part is the superior wall, and of course it is covering the diaphragm as well. Anterior wall formed by the lesser omentum, peritoneum, which is covering the posterior aspect of the stomach, this area, because the second layer of the lesser omentum is covering the posterior surface of the stomach, and the anterior two layers of greater omentum. Yes, definitely this greater omentum has got two layers, the first layer and the second layer. So this is the anterior wall. So we can say that definitely that the anterior wall of the lesser sac is formed by the first and second layer of greater omentum. Posteriorly formed by the two layers of greater omentum. Again, the posterior layer, this is the posterior aspect of the lesser sac. So there are two layers, the third and fourth layer of the greater omentum. Then we can see the transverse colon. Transverse colon is also forming the posterior aspect of the lesser sac. So this blue color area is representing the lesser sac. So this is a posterior aspect. Transverse colon. Transverse mesocolon is this one, is the peritoneum that is attached to the transverse colon to the posterior abdominal wall. Transverse mesocolon has got two layers, upper layer and lower layer. Then the left kidney, because the transverse mesocolon is reflected onto the posterior abdominal wall, so where it is reflected onto the left kidney, so left kidney also comes into the posterior aspect of lesser sac. and the suprarenal gland. Above the left kidney there's gland, that is suprarenal gland. We can see here the lesser sac has got posteriorly the pancreas and also the left kidney located. The orientation of the structures, I think it is not clear to you, but when we see the organs it will be very clear. Now the omental bursa, lesser sac, communicates with the greater sac through the omental bursa, through the omental foramen. So the greater sac is connected or communicating with the lesser sac through the omental foramen. Now here, look at this. This is the lesser sac, this is the greater sac. Both are connected, both are communicating through a foramen here. That's called epiploic foramen or the omental foramen. Now omental foramen is located here. So this is the lesser sac. When you reflect the stomach, what you can see behind is the lesser sac, which is a closed sac. And what you can see here is this area is the greater sac. So we have seen the lesser omentum, how the lesser omentum is reflected onto the stomach. So if you push your finger onto the right aspect of the lesser omentum, we are passing onto the lesser sac. So this area is the epiploic foramen through which the lesser sac is communicating with the greater sac.